It's all about sex today, and we're going deeper. We're talking about a condition most men don't want to talk about, erectile dysfunction, or ED. We explore what it is, what causes it, and how to prevent it. But it's more than just sex. Sometimes problems in the bedroom can signal something more serious.
Sexual health can be a really difficult thing to talk about, but oftentimes issues that arise that relate to sexual health can be related to other health problems.
We've all seen the commercials promising to reverse ED. We'll see why those over-the-counter drugs may not be what the doctor ordered.
If a man is experiencing these issues, there seems to be a tendency to look for an easy fix, but really we need to get to the bottom of what the problem is.
What can cause sexual dysfunction and how to heat things up in the bedroom. It's all straight ahead in this week's edition of Prescription for Life. Hello, and thank you so much for joining us. I'm Monica Robbins. We have a lot to talk about in this episode. Doctors stress treating sexual dysfunction should be just as important as seeking treatment for any other health condition. But before we can get to the solutions, we must explain exactly what we're talking about. Sexual dysfunction is any problem that prevents a person or couple from experiencing satisfaction from sexual activity. And while it's not the only type, erectile dysfunction is the most common type of sexual dysfunction. When it comes to ED, it's an issue that can affect quality of life and self-esteem. Erectile dysfunction is the inability to attain and maintain an erection sufficient for sexual intercourse at least 25% of the time. The problem often develops gradually. When it happens on a regular basis, it's time to talk to your doctor. And that's the issue. Most men shy away from talking about this issue with their doctor or anyone else for that matter. So we're bringing the expert to you. Take a look. Joining me now is Dr. Peter Bayach, a urologist with Cleveland Clinic. Thank you so much for being here.
Thank you so much for having me.
All right, a lot to unpack here. So, is there a warning sign men should be aware of when it comes to their sexual health that, okay, before they need to come see you, I need to talk to my doctor about this?
Sure. So sexual dysfunction is very, very common. And the most common type of sexual dysfunction for men that they're likely to seek care for is erectile dysfunction. Erectile dysfunction is actually usually a blood flow problem, particularly for men over age 40 or 50. And that type of blood flow problem can happen from conditions like high blood pressure, high cholesterol, diabetes, or even from smoking. So it's often the first sign that there could be a more serious problem that might be going on with their heart or with blood flow. So it's really important that if they start to experience that, and it's something that is more than just a one-off event, that they seek an evaluation by their doctor, and that can be their primary care doctor. Or they could also come to see a urologist about that.
Why is it important to talk to your doctor about your sexual health?
Well, sexual health can be a really difficult thing to talk about, but oftentimes issues that arise that relate to sexual health can be related to other health problems. And people who experience sexual dysfunction are actually more common to have other conditions like depression, anxiety. So it's really important to communicate both with one's partner and with their physician about what they're dealing with. Sometimes folks might not think that these types of problems are important or things that their doctor cares about, but we really want to know anything that's going on with your health, including this stuff, which is really reflective of how your body's working.
On average, how long does someone wait before they actually come to their doctor and talk to you?
There's a lot of different types of patients out there, but in my experience seeing men with sexual dysfunction, many of them have been dealing with these problems for years, sometimes as long as 5 to 10 years before they've felt comfortable coming and talking about it. And I always tell my patients, I'm used to having these conversations multiple times a day, so there should really be no shame or embarrassment. You're not going to run into your neighbor in the waiting room or anything like that. For guys that are worried about physically coming in person, we offer virtual visits that they can do from the comfort of their own home. I also encourage men to discuss things with their partners, because these types of issues can be frustrating for both members of a couple. And some men who are single and experiencing these issues might actually avoid even starting conversations with potential partners. So the more you can discuss it, the more you can work towards a solution, the better.
Is it possible for these problems to happen to men under 40?
Absolutely. These problems can happen to men of all ages, but the most likely cause is kind of different depending on age. So in younger men, sometimes we see men as early as their early or mid 20s. These men tend to have, they tend to have erection issues that are more commonly due to mental health issues, whether it's just performance anxiety, maybe they had a bad experience or they're dealing with a rough breakup recently, or sometimes it can also be related to side effects of certain medications. So those are all things that we take into consideration when we're evaluating a guy, but we do see men of all ages.
Can lifestyle choices impact sexual health?
Absolutely. The biggest one that I see in my practice is the effects of smoking on erectile function. So smoking is a known cause of cardiovascular disease, and one of the first signs of that is erectile dysfunction. Other things like, having an unhealthy diet or being overweight can contribute to conditions like high blood pressure or high cholesterol, or even sleep apnea, which is a condition that affects sleep. If you're not getting high quality sleep, if you're not taking care of your body, sexual function is one of the first things that might suffer.
What about testosterone levels? How big of a role do they play?
Yeah, so in my patients, I find a common misconception that testosterone is the most, or testosterone deficiency is the most common cause of erectile dysfunction, and it's not. But it does play a role in some patients as kind of one of many contributing factors. Testosterone levels in men can decline with age, and in some men, they might develop some symptoms from that. So testosterone therapy, which essentially would mean if a man is deficient in his testosterone level, we would give him testosterone, may be helpful in some men who are not only experiencing sexual dysfunction, but also low libido or sex drive, lack of energy, etc. So for those men, we sometimes consider trying testosterone replacement and basically seeing how that impacts their sexual function. So that's definitely something that we pretty commonly will check in our new patients who see us with these issues.
So obviously women go through menopause. Do men go through menopause?
In some ways, all people go through changes that are normal and that happen with age. And it's important for folks when it comes to their sexual function to understand that every 10 years that they get older, their sex life is not necessarily going to be like what it was when they were 20. So there is some natural kind of evolution that happens, but it doesn't mean they can't have a perfectly satisfactory experience with that. One of the things that can decline with age, as I mentioned, is the testosterone level. So in men who are experiencing symptoms that could be attributed to that, that's definitely something that we want to check on, and if appropriate, treat them. But other things in some men who have a history of medical problems like high blood pressure, they might experience decreasing blood flow as they move on through their life, and that can contribute to their sexual dysfunction as well.
For men who have partners dealing with menopause, what do they need to know?
So this is something that this is a conversation I have with my patients every single day. When it comes to sexual dysfunction for folks that are in a relationship with somebody, we always want to take into consideration both members of the couple and what things might be going on with them. So although I see men in my practice for sexual dysfunction, almost every visit we also talk about what might be going on with their partner. Sexual dysfunction is one of the most common consequences of menopause. So women who have gone through menopause or are going through menopause commonly experience issues relating to pain with intercourse, lack of lubrication, lack of libido. These are all common and also very treatable things, okay? These symptoms happen as a result of there being less estrogen in the body and interestingly, also less testosterone. Many of us think of estrogen as something for women and testosterone as something for men, but the reality is both men and women have both. And after menopause, those hormones are deficient. So there are some very safe and effective treatments like vaginal estrogen and or vaginal, it's called DHEA, which is a substance that converts to both estrogen and testosterone, which are very safe and effective at addressing these issues and do not carry a risk of cancer, which is a common misconception. These drugs do not get absorbed into the body. They just act in that area to address these specific issues. So I commonly will send the partners of my patients to some of my partners who focus on this area to make sure that both members of the couple are optimized.
Still ahead, Dr. Bayich has more to tell us about sex, including some common misconceptions about a healthy sex life as you age and the heart and sex connection.
Your cardiovascular fitness is very much tied to your ability to perform sexually.
Plus, what men and their partners need to know about menopause. It's all straight ahead on Prescription for Life. We've been talking about erectile dysfunction, which is the most common type of sexual dysfunction. Dr. Bayich talks about the effective treatments out there and what men can do to possibly reverse ED. A lot of misconceptions are that when you get older, unless you get a little blue pill, sex is out of the picture. That's not true.
It's not true. Not all men experience these issues like erectile dysfunction. I actually have some patients who I see for other problems, let's say for prostate issues, who I always ask if they're experiencing any problems with their sex life, and some men even into their 80s are still functional without the help of medication. These are usually guys that are pretty fit from a cardiovascular perspective. There's actually some pretty good evidence to suggest that regular cardiovascular exercise, 45 minutes, 3 times a week of exercise where you're kind of getting out of breath, where your heart rate is getting at least 70% of the maximum or higher for a sustained period of time, may not only be protective against erectile dysfunction, but may actually help to reverse some of it. So the message here is that your cardiovascular fitness is very much tied to your ability to perform sexually.
You just cleared the room. Everyone went to go for a run right now. So. But another important point is that, just because you're older, are you less likely to get a sexually transmitted disease?
When it comes to sexually transmitted diseases, there is no age criteria on who's at risk for that and who's not. So it's very important for folks to know that regardless of their age, they are at a risk of that. Besides completely abstaining from sex, the safest way to prevent sexually transmitted infections is using barrier contraception like condoms. So many of my folks or many of my patients who are later stages of their life, maybe they're newly retired and single and dating, we really emphasize the importance that these are things that they need to keep an eye out for.
Final thoughts, what do you want to leave everyone with?
So I really just want to stress that although these can be difficult conversations to have, it's so important to start these conversations, whether it's with your doctor or with your partner, because not only are these problems sometimes a result of serious medical conditions, but we have so many ways of getting people to the point where they can have a perfectly satisfying and happy sex life. We can offer treatments for really any type of sexual dysfunction. For men with erectile dysfunction, there are so many treatments out there, no matter the severity, no matter how long it's been going on. We have medications, we have regenerative treatments, we have things like injections and devices and implants. And you'll never really know the full story about what these options are without starting that conversation, whether it's with your partner or with your physician. Just take those steps in the correct direction, and there really shouldn't be any shame about it. And that's just one sexual dysfunction. Correct. There are so many that people can talk to their doctors about. Correct. And, on a day-to-day basis, we're having conversations with guys not only about their erections, but about things like premature ejaculation, about things like low sex drive or low libido. And these are all things that we have a lot of options that we can improve men's quality of life.
All right, Dr. Bayich, as always, thank you for your insight.
Thank you so much for having me.
Dr. Bayich talked about how sexual dysfunction can be a signal of some other underlying health issues. Men who also have enlarged prostate may experience erectile dysfunction as well. A Georgia man went to his doctor after experiencing frequent urination and was forced to wear a diaper due to his condition. Frederick Price has his story.
As an 84-year-old, James Burnett considers his life simple, and among some of the things he cares a lot about is his wife of 67 years.
We're a bored couple. We don't smoke, we don't drink, but we just have a good time.
In April, his life would become more interesting, if you will. His daughter, Kim, tells me he began having difficulty using the restroom.
He had started wearing a diaper, and that brought him a lot of relief not to have to worry about, wetting himself.
After enough discomfort, both decided it was time to visit his doctor. They quickly found a problem: benign prostatic hyperplasia, or an enlarged prostate.
My prostate completely stopped up, and he said it was just like your fist.
According to the National Institute of Health, about 80% of men older than 70 are diagnosed with BPH. There are a number of ways to treat it, and at Piedmont-Macon, Dr. Joseph Baer uses a fairly new procedure known as aquablation therapy.
Using the robotic technology of mapping out with ultrasound, we can actually do a formal mapping of the prostate.
Using high-pressure water jets, doctors can remove tissue in the prostate, relieving the patient. Dr. Baer says he is the only physician in Central Georgia offering this, completing about 20 procedures in 8 months.
We're not just trying to help them urinate, we're also trying to preserve sexual function.
Burnett can now return to mowing his lawn and fixing up antique cars. At its peak, his restroom visits were 8 to 10 times a night, now down to about 2. Grateful for that, and through it all, Burnett tells me fear wasn't an option.
I've had 2 bypasses and a pacemaker, but I got the Lord. I ain't worried about nothing.
Midlife fatigue, moodiness, more fat, less muscle, a declining libido, symptoms common to women in menopause, but men can experience these same issues. Okay, let's get straight to it. All women at some point in their lives go through menopause. Their reproductive hormones reduce to the point they become infertile and can no longer have children. As for men, that's not the case.
Just because it doesn't happen as abruptly, right? There's not one time point where the switch turns off and you stop having testosterone. It happens kind of gradually as men age.
Unlike women, men can still be fertile or may not notice any significant symptoms or changes at all. For that reason, we say women go through menopause. Men may experience a condition called andropause, or better yet, testosterone deficiency.
Testosterone deficiency basically refers to a situation where a man's body is not producing enough testosterone for what his body needs.
We checked in with 2 of Cleveland's top experts in the field for a question and answer session on the topic. Dr. Nanin Thirumavalavan, Chief of Male Reproductive and Sexual Health at University Hospitals, and Dr. Peter Bajik, urologist and assistant professor of urology at Cleveland Clinic Lerner College of Medicine. One reason for the nickname male menopause or manopause is that many of the symptoms are the same.
Feeling sort of tired or sluggish is one of them. A decreased energy, a decreased sex drive or libido. You can notice some physical changes, like a decrease in sort of muscle mass or increased sort of fat mass.
Treating a testosterone deficiency can be relatively easy. There are a host of treatments your physician can prescribe, from gels, injections, a pill for testosterone, a nasal spray, or even pellets injected right under the skin that dissolve over time. But, and this is a big but, doctors first need to make sure that something else isn't to blame for the symptoms.
If a man is experiencing these issues, there seems to be a tendency to look for an easy fix. but really we need to get to the bottom of what the problem is.
Diabetes, weight gain, and undiagnosed sleep apnea are just a few.
Don't hide things. You can't get help unless you kind of know what's going on or your doctor knows what's going on. And even at a young age, we're seeing some medical problems crop up, and we're able to treat them and make your quality of life better overall.
And these days, you can't turn on the radio, TV, or open a magazine without seeing pills for a stronger libido advertised, or erectile dysfunction medicine prescribed online. Here's the chief reason doctors say they're a bad idea.
These direct-to-consumer services do not do as good of a job of getting to the root of what the problem is and performing those really important diagnostics to figure out maybe you do have underlying cardiovascular risk factors that could in a couple of years lead to a heart attack. So it's important that men know this and that they not look for those easy fixes and really make sure you have a primary care doctor that's checking your overall health.
That'll do it for this edition of Prescription for Life. Thank you so much for watching. We'll be back next week with another dose. Until then, I'm Monica Robbins, wishing you and yours good health.